Hi, in this video, me and Seema are gonna continue on our discussion about cold exposure, and we're especially gonna focus on the brain aspect, the dopamine aspect, some other catecholamines, and how potentially cold exposure can be used for brain repair and longevity benefits. So welcome.
So how does cold exposure affect the brain and things like neurotransmitters?
Yeah. So this is a very interesting research field, has been quite a big topic recently. Cold exposure has been shown to increase dopamine, and that's probably the biggest takeaway from all of the studies, which are not many, but are quite promising. And animal studies and human studies point to the same direction, that cold exposure can be used as a safe way to cause a steady increase in your dopamine levels. So I want to specifically point out one study in which they had 10 men doing a 1 hour cold exposure in different temperatures. So they compared 30 degrees, 20 degrees, and 14 degrees, which are in Fahrenheit about 89, 68, and 57 degrees Fahrenheit. And the men sat in cold water, immersed in cold water from neck down for 1 hour, which is a pretty long time to be in a cold water. I wonder what they did. Like, did they have music or something there? Or because that would have been a very meditative experience as well, if they just sat and breathed. I didn't find that information in the paper, but probably they just sat there. And so they looked at the cold effects on different metabolic markers and neurotransmitters, and they reported that being in a 14 degrees water, so that would be the 57 Fahrenheit, increased dopamine levels, norepinephrine levels, and also metabolic rate. But the dopamine and norepinephrine increases were pretty high, so dopamine increased 250%, norepinephrine 530%, with a little bit different time course. So dopamine started rising and steadily up until 1 hour, and then it kind of remained pretty level up until 2 hours, which was the period that they monitored the men. So I would assume that it stayed elevated for a lot longer than the 2 hours. Noradrenaline did a rise quite rapidly, quite high, and then there was a way larger or steeper drop in that one. What was interesting in this study in terms of dopamine and noradrenaline is that we regard these as, especially norepinephrine. So noradrenaline and norepinephrine, I use these interchangeably. They are the same neurotransmitter. They both increased, whereas adrenaline did not. So it wasn't like, it was a stress state, but I would say it's like less stressful than something like fast fear reaction.
So it's like exercise, or exercise also increases.
Exactly that. It's very similar to that one in terms of also what it affects and does to your neurotransmitters. So specifically these neurotransmitters, dopamine and norepinephrine, are very important for focus, alertness, and vigilance. They increase your ability to, first of all, gate and maintain attention, and also flexibly change attention when needed. And low dopamine is characterized by anhedonia and low motivation, and this kind of general lack or willingness to do stuff. And noradrenaline, norepinephrine is important, for example, for this kind of sustained attention, where you may have some disturbing signals or something that requires this kind of very long stretches of focus to certain things.
Yeah, but what about the, dopamine has the reputation of being like this addiction neurotransmitter and, being addicted to stuff. So many people would suggest or think that this increase in dopamine from the cold exposure, makes you more addicted to stuff, or is the cold exposure itself addictive, or what's that?
Well, that's a good point. It's not an easy topic to study, like different dopaminergic signals and how much do they spike or drop dopamine and in which pathways they affect. But what the study seems to point is that there are certain things that cause very rapid spike in dopamine, like sugar, chocolate, social media might do that, nicotine, things like that, some mind-altering drugs. And then the dopamine drops pretty rapidly below the baseline. This is sometimes referred, especially in the book Dopamine Nation, book of Dr. Anna Lemke. It's an excellent read, also talks about cold exposure. She talks about pain-pleasure balance. So it first comes to rapid pleasure, then it drops to the pain side, sort of, which is just a relative drop in the dopamine levels in the brain. So this would be the kind of like addictive pattern. Whereas things like cold exposure, they don't cause that rapid drop. So I don't know how, like they didn't monitor these people who did the cold exposure for a long time, but at least up until 2 hours, they saw maintained steady dopamine levels. Whereas let's say you take sugar, that would cause a sugar high dopamine rush in 5-10 minutes and possibly decrease it in 20-30 minutes. So then it caused this, what we experience as almost like pain or a lack, and we crave more. So I would say...
I don't think many people will crave the ice bath, 30 minutes later.
That's the thing, like the experience is not super pleasurable. I mean, people may want to go again, but more because they know what comes after.
Yeah.
Not because the experience itself feels so good. Whereas social media and sugar might be things that the experience itself causes such a rapid increase in dopamine that it causes the pleasure first and then comes the pain. So you live in craving. Whereas cold bath, it's kind of like the opposite. You push the lever first to the pain side and the pleasure comes steadily after.
And from the addiction side, we talked about it in the part 1 of the leptin sensitivity, so that the cold increases leptin sensitivity, and that actually reduces your food intake and reduces or increases satiety, so you're less likely to overeat. So that's good counterbalance. Or is it something that everyone should do and to improve their mental health or dopamine levels, or is there any specific? We mentioned addiction, so that can be beneficial possibly, but any other conditions?
Yeah, so as I said, things like addictions doesn't have to be a clinical addiction. If you are wanting to quit morning social media scrolling, you could use a cold shower instead to support that happy feeling, that dopamine. Maybe if you want to reduce your coffee intake in the morning, cold shower could be very beneficial for that one.
Yeah.
If you just want more focus and attention in the morning hours, then first thing, a cold shower in the morning would possibly... There are not that many studies in cold showers and dopamine, unfortunately, yet, because it's a very difficult thing to study. But that would be probably a good way to increase your dopamine in the morning. Cold exposure might be good if you are having some sort of mood dip, maybe depressive symptoms. There was this study in cryo chambers. So cryotherapy is basically, it's this kind of like a booth where you will go and stand and tube, and the temperatures are very cold. In there it's below 100 minus 100 degrees Celsius. So they go very, very cold. You stay there only 1 or 2 minutes, so it's also safe. It sounds pretty harsh, but it's safe. So what they found is that there were 92 adults, so pretty big group, between 20 to 70 years old, so all ages, and they underwent 10 whole body cryotherapy sessions. And they found statistically significant improvements in clinical depression, life quality, self-assessed mood, and disease acceptance. Possibly, depression is linked to lower dopamine signaling, and there is a chance that this is one of the mechanisms in which cold exposure will improve mood. But there are, of course, not a lot of studies in this topic yet, but I see that's a very potential way to at least use as an alternative or complementary treatment to support the recovery from depression.
Yeah, I mean, it does feel very euphoric after you come out of the cold.
Yeah, it does
And-
increase beta endorphins as well.
Yeah, and it maintains this good positive mood, almost like, or high mental clarity and stuff for the rest of the day almost.
Yeah, and that's most likely because of the catecholamines that it increases, and the euphoria comes from the beta endorphins. Then one thing that I think is important mechanisms, we talk about physiology a lot here, like neurotransmitters. There is, of course, also the thing that when you start training cold exposure, you have to put your body under stress deliberately, and you need to overcome some limits that you may have, some limits that you think you have. But then you overcome these limits, which increases psychological quality called self-efficacy. Means that you have the internal belief that I have a challenge, but I can overcome it with my own internal qualities, with my own internal mindset. And self-efficacy is one of the most important psychological mechanisms of basically being optimistic and progressing with life goals, and also overcoming clinical symptoms.
Yeah, I mean, it kind of increases your like confidence of overcoming challenges, or because if you do like a lot of people who aren't used to it, like in these boot camps and stuff, they go to the ice bath for the first time, and where they, you know, achieve it with the help of an instructor, then they're like, wow, I did it, or they're like super, I don't know, motivated and super like surprised that they could do it, and they're like super proud of themselves as well. So it does increase, it's a small victory that increases your self-confidence and
For sure.
ability to believe in self. And yeah, I mean, if you do it every day, for example, with a cold shower, then it's like the small little victory that you do that gets the pendulum swinging or momentum on your side, that the rest of the day is also somewhat easier, and in some sense increases your, you know, you believe that, hey, I was able to overcome this challenge, I'll also able to overcome the challenge of going for exercise or whatever the other thing that you need to do.
Yeah, for sure. And one thing that it is a stressor. The prefrontal cortex is basically the brain area here behind your forehead that tells your emotional centers of the brain, like the limbic system, that, hey, it's all cool, I can handle it, no need to panic, no need to fear. So when you go into the shower, you need to train that prefrontal cortex. You need to calm yourself with self-affirmations, focusing on your breathing or whatever. And this does train the networks that help to use the prefrontal cortex to lower the activity, for example, in the amygdala, in the fear centers. So it's maybe a bit similar to meditation or just calming yourself down. But in this setting, when it's cold exposure, you are all the time in control. You control your stress and you control your stress control.
So it's like the Tibetan monks, like they set themselves on fire and meditate, but it's like a more
that wouldn't be as safe as cold exposure, I think.
It's a like you know, light version of that. You just do a cold to control your reactions, and that improves your self-control overall.
Yes, I think this is a better way.
But what about anti-aging and longevity in terms of like the brain? So, you know, the brain is also something that ages.
Yes. So there are two different points that I briefly want to discuss here. There is not so much controlled studies on longevity benefits of cold exposure to the brain. But what drives brain aging is the loss of synaptic connections, basically, and the dendrites in the neurons. And studies show that in hibernating animals, which goes into the deep cold shock, their brain gets basically atrophy. So the dendrites starts to die and everything starts to decline. But when they come out of the hibernation, they get like almost like a rebirth to the brain. So everything starts to be boosted, like the regeneration of the dendrites, the branching of the dendrites and the neurons. And that's a similar speed that's only seen in the embryonic period. So that's why I say the rebirth of the brain. I think it's very fascinating that this mechanism is like boosting the brain growth similar to as they were young again. So maybe that would be one of the things that could happen in the human brain as well. At least animal studies show that after cold water swimming, there is an increase in brain growth factors like BDNF. And also there is this cold shock protein increase, which boost neuronal growth as well. Also, there is therapeutic hypothermia, which is used after brain injuries to regeneration and repairing the damage in the central nervous system. So yeah, I think although very little studies, very few studies, there seems to be promising early studies to show that it can boost brain growth and regeneration. But the protocols, that is something that I don't think anyone can at the moment say very reliably in terms of, cold showers or cold bathing. Andrew Huberman had this rule. I don't know what is it based on, probably science, because he's a scientist, but he had he had like an 11-minute rule. Something like that's a good place to start, or do 11 minutes a week of cold exposure, whether it's like a cold bathing or ice baths, cold baths or cold showers, and preferably divided in different days of the week. So let's say if you take 1 minute cold shower each morning, you are getting or 2 minutes, you're getting this benefit. And I think cold swimming is very good. It's hard to get the chance to do that though. But if you kind of have a chance, then definitely I would start with the trainer, because it's still hypothermia. It's still dangerous if you don't know what to do. There are some quite sad cases or where people just go on and jump in an ice lake and the outcome is not so good. So that's why with a trainer also, they teach you the mental aspect. They teach you how to get in there safely.
Yeah.
And then, with a group is always good as well. Good idea. So here were a little overview of the brain and mental health side of the cold exposure. I would say as a summary, it's an excellent practice to support dopamine, catecholamines, when you do it regularly and you do it safely. So there are different options to explore. Cold showers, pretty much available for anyone. Thanks for watching. I hope it helped. If you want to learn more about the brain, mental health and longevity, check out my other videos as well. And check out the part 1 from Seam's channel.